step in. So over to you, Oscar Onyisa.
Thank you very much, Adejumo Shoika. Good morning, everyone. Those of the panelists, our speakers, and of course, the guests who are joining us, and those of you watching via Facebook streaming live, thank you very much for being here this morning. We appreciate the time you've taken to be here. And it is indeed a very, very important topic that we are discussing here today. And the theme is Nigeria and the next pandemic, preparedness, response, and vaccines. I'm sure that we have all had our fair share of the COVID experience, either directly or indirectly. In some instances, unfortunately, I'm sure a number of us has lost a loved one or know somebody who has lost a loved one. So it's fair to say that this is a pandemic that has touched each and every person here watching and listening, and also to a large extent the human race. And when something of this magnitude occurs, it's only right that we should find a solution to the problem. Thankfully, various vaccines are out, and it's been distributed, some on their first shot, some on their second shots, but it's still a battle, and the war is not yet over. I would like to formally thank the Conversation Africa for putting this together in conjunction with the Nigerian Academy of Science, partners, New Central, Punch Media Foundation, Nigeria Info FM in Lagos, Nigeria. That's Punch and Nigeria Info hopefully should be picking up the live stream as well, and also write some articles around this. But the idea basically is to get the message out there and to ensure that we are prepared for not only resolving this pandemic, but any other pandemics that come. So I do have with me a gathering, a very enlightened gathering of policymakers, of professors, of doctors, of people who have carved a niche in their particular field and scope, and they'll be bringing to bear their wisdom, knowledge, and contributions to this particular topic. And I also have the honor of moderating this session, and I hope we do have a good takeout from this particular conversation. And this is the first of many conversations that will be happening, courtesy the Conversation Africa. And I am Bemileke Oscar Onyisa. It's great to have each and every one here. So just to make sure that we're all here, just give me a wave in your camera or in the chat room for those who can. For those of you streaming, just type in the comment section on Facebook, just say, great to be at this conversation. So while I was posting about this event, I said, or I put in my caption that this is going to be a very contagious conversation. And I think that is the only time I'm allowed to use that word in a positive light. So without taking too much of your time, we have a quick run through, which is a very simple run through of our speakers, our panelists. But I think it's only right to recognize the presence of some of the people that you will be meeting before the regional editor of West Africa comes on to talk about why we are here. First, in no particular, okay, there is an order because we do have a policymaker here in the person of the Nigeria, that's the Minister of State. He's a man that has been saddled with the responsibility of the health sector in Nigeria, and I'm talking about none other than Dr. Adeleke Mamora. Thank you very much for being here with us. Appreciate you. You can just unmute your mic just to say hello to everyone.
Hello, everyone. Thank you very much. Thanks for inviting me. Good morning.
Fantastic. Great to have you here, sir. We also have with us the first woman to be appointed as a Provost College of Medicine and University of Lagos, and later the Deputy Vice Chancellor and Acting Vice Chancellor, in the person of Professor Folashade Ogunshola.
Good morning. It's great to be here.
Great to have you here. So I didn't want to say this before, but I am alumni of University of Lagos, graduated from there, chemical engineering, and University of Lagos is the greatest university in Nigeria. We all agree.
Yeah.
Greatest Akokites. So we also have with us, for those who disagree with that, there's nothing you can do because I can mute your microphone, so sorry about that. We also have with us Dr. Doyin Odubanjo, a public health expert and executive secretary, Nigerian Academy of Science. Thank you very much he was very much involved in the 2013 Ebola outbreak, the management of it, and of course, COVID-19 outbreak in Nigeria. Good morning, sir.
Thank you. Good morning. It's a pleasure to be here.
A real pleasure. You went to University of Lagos as well, I presume, sir?
No, the first and the best, Ibadan.
Okay, I'll get admin to exit you from the group. Great to have you here with us, sir.
Thank you. It's a pleasure.
Okay, so we also have the president of the South African Medical Research Council. She's a member of the Academy of Science in South Africa and chairs the country's Standing Committee on Health. Great to have Professor Glenda Gray with us. Good morning, ma'am.
Good morning, and I'm sorry I'm not from University of Lagos.
It's okay, you're forgiven. But what university were you from? Or are you from?
The best in South Africa, University of the Witwatersrand. That's university.
I think everyone's university is the best. So which is the worst? But it's fine. Great to have you with us. Thank you so much for being here. I also have a world-renowned professor of virology with more than 40 years of experience. He's led research into the study of several viral infections, contributing significantly to the research in polio, Lassa fever, and the Orungu virus. Ladies and gentlemen, please do make welcome Professor Oyewale Tomori. Prefers to just be called Oyewale Tomori. Great to have you here with us, sir.
My pleasure. Thank you very much.
He's a man of very few words. We also have a specialist of molecular biology and genomics in the Department of Biology Sciences at the Redeemers University. He leads the African Center that did the first genome sequencing on the SARS-CoV-2 virus. Please do make welcome Professor Christian Happy.
Thank you very much. Nice to be here.
Great to have you here with us. Looking forward to your contribution as well. And I think that about sums it up. I will hand over very soon to lead the introduction, so to speak, as to why we are here. And I'd like to cede the microphone to the West African Regional Editor in the person of Mr. Adejuwon Soyinka, to take it from here. Over to you, Adejuwon.
Thank you, Oscar. Fortunately, I did my master's at the University of Lagos. So
good man. Fantastic.
I will be breaking the shame in that sense. Well, good morning, everyone. Once again, it's a real pleasure having all of us here today. As I've been introduced, my name is Adejuwon Soyinka. I call myself the chief servant of the conversation in West Africa. So I exist in West Africa region to serve my colleagues and serve them in whatever capacity they need me to. This morning they've asked me to do the welcome at this event, and also to introduce this event and explain why we're doing this policy dialogue. In the room this morning, my colleagues spread across the continent, for colleagues at the Conversation Africa, starting from our head office in Johannesburg, South Africa, my colleagues in Nairobi, Kenya, my colleagues in Accra, Ghana, Dakar, Senegal. Also in the room, conversation colleagues from the different parts of the world, the UK, Australia, the US, Canada, Indonesia, and name it. I must also especially welcome speakers and panelists, starting with the Honorable Minister of State for Health, Senator Adeleke Mamora. I mean, he basically personifies one of the main reasons we put together this policy dialogue, because the essence is to bring in people who are policymakers and experts in the field into one room and get them to have a conversation that speaks to where we are and where we're going. And the Honorable Minister, has been the legislative arm of government in Lagos State, actually was Speaker of the House of Assembly, then went on to the Senate, has been lawmaker at state and federal level, and now is in the executive arm of government implementing policies. So yeah, we're honored to have you here today. We're honored to have Dr. Donyo Dubanjo of the Academy of Science. We're honored to have Professor Tomori, Professor Api, and Professor Folashade Ogunshola, and Professor Glenda Green from South Africa. We're honored to have all attendees on the line this morning. Thank you all for honoring our invitation and for being here today. So you may be wondering, for those of you who are not quite familiar with the Conversation in Africa, you may be wondering, so what is the Conversation and what do we do? So what we do is we're a media organization that works, every day around the clock to ensure that the works of academics and scientists are translated and published in the language that the ordinary man on the street will understand. In fact, we tell ourselves that we pride ourselves in ensuring that academic papers and scientific write-ups are written and translated into mass media language, such that a 17-year-old can understand what you've done as a researcher and can be able to translate it, interpret it, and make good use of it in terms of inputs into their livelihood, inputs into solving problems of the society. Because what we've found is that in the ivory towers, we have loads and loads of body of knowledge, residing sometimes on the shelves, residing on the pages of published research work that needs to be translated, and be brought into public view. And that's what we do on a daily basis at the Conversation. Since we've launched in Africa in 2015, we've published the work of over 4,700 scientists and researchers, and their combined articles have been read by over 90 million readers worldwide, proving that our communities and our societies want to hear from experts. They want to know what they're talking about, and also proving that scientific voices do matter. So that brings us to the core of why we're gathered here today. We're here today to have the policy dialogue, and basically what we're trying to achieve is this is another way, of achieving our aim of engaging scientists and bringing them together with policymakers and the general public on important topics of the day. And of course, we did a general scan. What can be more important than the topic of COVID-19 and the impact that it has had, not only on Nigeria, but on the continent of Africa and the rest of the world. In fact, but for COVID-19, this event, for instance, would have been a physical event. We probably all have gathered in a big hall with banners and cameras and all of that. But it's happening virtually because, again, the impact of COVID-19. So in just a few months of COVID, it's changed the way we live, it's changed the way we work, it's changed the way we've interacted, and sadly, it's also taken a number of lives and impacted the economy, majorly and badly across the world. So the essence of this dialogue is to bring policymakers into the room, bring the experts on the field into the room. Let's hear from the experts about what we need to do or what we've done right. Let's first hear from the policymaker, that's represented by the Honorable Minister of Health here today, who will tell us about what Nigeria has learned from the pandemic, how Nigeria has risen up to the challenge, what has changed, and then looking into the future, how prepared is Nigeria for the next pandemic. Assuming, as many people would say, God forbid, assuming there's another pandemic tomorrow, how prepared is Nigeria to handle that situation? So we will get that overview this morning from the Honorable Minister, and then we'll get an overview from Professor Christian Api, whose center conducted the first genome sequencing of SARS-CoV-2 on the continent of Africa. And then we will delve into the panel discussion where we hear more from the panelists who are also experts in the field. Once again, I want to welcome everyone and thank you especially for joining us this morning. I'll now hand over to our moderator to take us through the rest of the proceedings. Thank you.
All right, thank you very much. Okay, just wanted to make sure you can all hear me. All right, thank you very much, Adejuwon. For those who just joined, either in the Zoom or via Facebook, great to have you here. That was the West Africa Regional Editor, Adejuwon Shoyinka, just giving us a background as to why we are here. We've already introduced a number of the speakers and, of course, the Honorable Minister as well, who will be giving the keynote address next. But just some housekeeping rules, just to make sure that everyone is A-OK. For those of you in the Zoom room, we have the chat room where you can drop your questions. So make sure that if there's anything that comes to your mind, any question you want to ask, just drop them there. And for those of you streaming, feel free to also drop it on the Facebook page of this particular stream. We thank you so much for taking the time to be here. And you being here is a testimony to the fact of how important this is to you. We have close to about 100 of us in the Zoom webinar, and I'm sure a lot more that are streaming live. Without taking too much of your time, it is indeed a great pleasure to introduce the next gentleman. He is a man of substance. He's a professional to the core. And if any country wanted to hand over their ministry of health to anyone, he will definitely be top on the list. He obtained a BSc in Health Services, Bachelor of Medicine and Bachelor of Surgery. That's the MBBS, University of Ife, and became a health practitioner. He was also a medical doctor of a medical center from 87 to 98 and a company medical advisor. As you all know, he delved into the political terrain with his expert knowledge, and he has basically been in the corridors of the health system, whether it's the United Nigeria Congress Party, where he basically kicked off from way back in 1998. And then he was also elected the Lagos State House of Assembly member in 1999 and appointed Speaker. He was the chairman of the Conference of Speakers, and the list goes on and on and on. But the reason we have him here is that he is indeed our Honorable Minister of State. And of course, this is a parastatal honor of the Federal Minister of Health. And it is indeed with great pleasure that I do make welcome the one and only, let me just say, Dr. Adeleke Olorunbe Mamura. Great to have you here, sir.
Thank you very much, Oscar. And let me acknowledge the eminent panelists on this platform, invited guests and distinguished ladies and gentlemen. I cannot just leave it at that without specially recognizing my good sister, my friend. We were classmates at the medical school, Ife. And that's Professor Folashade. I was just going to say, well, she's Professor Folashade Okunshola. I was almost going to mention her maiden name. But then, Oscar, I'm saying this so that just to remind you that when things, went awry at University of Lagos, a graduate of FIFA had to be called in to fix the crisis. So, Daddy, thank you very much for being part of this. We're proud of you. Thank you very much. And of course, all the other eminent panelists. So for want of time, I'll just go on to make my presentation. Thank you very much to the team at the Conversation Africa for graciously inviting me to deliver the keynote address at this Science Policy Roundtable. I recognize that this is an incredibly important meeting in reflecting on our response so far, identifying lessons learned, and thinking about our preparedness for the next pandemic. Of course, the topic is clear: Nigeria and the next pandemic, preparedness, response, and vaccines. As requested by the roundtable organizers, I will reflect on 5 key lessons that we have learned from the COVID-19 pandemic and how these lessons have prepared us for future pandemics. I thought it best to set the scene with an understanding of the risks that we face in terms of infectious disease outbreaks in Nigeria. In the last decade, or thereabout, Nigeria had faced several public health challenges. In 2014, Nigeria responded to an Ebola outbreak that affected 4 other West African countries. We did this with relative success that was recognized globally. In 2017, we recorded the first monkeypox cases 40 years after the last case was reported in the country, and have continued to learn from this. In the same year, the first yellow fever cases were reported 21 years after the last case in the country. Over the last 4 years, there has been an increase in Lassa fever cases in the country. Almost every year, we record outbreaks of Lassa fever, cholera, meningitis, measles, and yellow fever. From this, we are no strangers to large infectious disease outbreaks. Our population estimated at around 200 million people, the tropical climate we have, and the high rate of travel and trade to Nigeria put us at risk of the spread of infectious diseases. So let me now briefly talk about the COVID-19 preparedness. When our first COVID-19 case was detected in February 2020, we had begun to prepare, but we did not have all the resources needed in place. This was the same case in nearly all other countries for significant reasons. The world was faced with a pandemic caused by a new pathogen that had never been detected previously. Of travel, we did not fully understand how the virus spread. We did not have vaccines, therapeutics to treat cases, and had only begun the development of diagnostics to identify the pathogen. At the beginning of the pandemic, various epidemiological models predicted a doomsday scenario for Nigeria and other African countries. This was linked to weak health systems compared to countries in other regions, high population density, notably in informal peri-urban settlements, prevailing conflicts, and humanitarian crises in a number of countries, and the contending burden of other diseases such as HIV, AIDS, tuberculosis, and malaria. Yet, till date, Nigeria and other African countries have reported far fewer cases and deaths compared to other regions in the world. But we must remember that it is not yet Uhuru. Prior to the confirmation of Nigeria's first case on 27th of February 2020, NCDC began monitoring the COVID-19 outbreak in China and conducted several risk assessments of the threat to the country. The initial risk assessment revealed significant gaps in critical areas, including surveillance, points of entry monitoring, case management, laboratory, infection prevention and control, and logistics. On the 22nd of January 2020, more than a month before the first COVID-19 case was confirmed in Nigeria, the first public health advisory was published and widely disseminated using traditional and social media. We started our risk communication very early. The Federal Ministry of Health, through the Nigeria Center for Disease Control, established a multi-sectoral national coronavirus preparedness group to ensure a cohesive and effective coordination of the country's preparedness efforts. This later transitioned to the National Public Health Emergency Operations Center. Before Nigeria's first case was confirmed, testing capacity was established at the Nigeria Center for Disease Control National Reference Laboratory and 3 existing laboratories within the NCDC Molecular Laboratory Network. These are Virology Laboratory of Lagos University Teaching Hospital, African Center for Excellence for the Genomics of Infectious Diseases, Laboratory at Redeemers University, Ede, where happily Professor Happy operates from. That's in Osun State. And of course, the Nigerian Institute of Medical Research, Lagos, followed immediately. The NCDC also began working with states and tertiary hospitals to map out and establish isolation and treatment centers for managing COVID-19 cases. In addition to this, NCDC began training health workers across all states on case management, infection prevention and control, surveillance, risk communication, and other areas of epidemic preparedness and response. The agency began to reposition medical supplies such as personal protective equipment to all states. Importantly, NCDC developed preparedness guidelines and plans that incorporated an all-inclusive One Health approach while adapting global regulations to Nigeria's context. The NCDC worked with the Port Health Services of the Federal Ministry of Health to institute point-of-entry surveillance at international borders, introducing thermal screening, compulsory self-isolation, and contact tracing. In summary, we were not as prepared as we wanted to, but we had made enormous efforts to establish testing, case management, risk communications, and other components of the response. In the next few moments, I will share 5 key lessons from Nigeria's COVID-19 response. And the first in the lessons learned is leadership and coordination. Nigeria's COVID-19 response has had strong leadership provided by the Presidential Task Force on COVID-19, PTF, established by His Excellency President Muhammadu Buhari. The PTF coordinated multi-sectoral intergovernmental efforts to contain the spread and mitigate the impact of COVID-19 pandemic in Nigeria. This was especially important as the COVID-19 pandemic was not a health problem alone. Although it has now transitioned, that is the PTF, to a presidential steering committee, the PTF served as a coordination hub for Nigeria's COVID-19 response, with leadership at the highest level of government. By having a multi-sectoral group at the highest level of leadership, we were able to coordinate strategic decision-making for the country, such as school closures, restriction on commercial flights, both local and international, movements, and others. The NCDC continued to provide scientific evidence and data to guide decisions by the Presidential Task Force. Many states also set up their state task force for multi-sectoral response. Nigeria recognized the need for multi-sectoral coordination early, and this made a huge difference in our response activities. Number 2 lesson is what I simply refer to as stronger together. And of course, it is incredible as to how much stronger we are when we work together. Prior to the COVID-19 pandemic, Nigeria had built strong partnerships with the United Nations organizations, regional health institutes like the Africa CDC and West Africa Health Organization, WAHO. Other institutions like the US CDC, the media, and several other groups. One collaboration that has stood out strongly is the private sector collaboration. Following the confirmation of Nigeria's first case, businesses and organized private sector through the Private Sector Coalition Against COVID-19, popularly referred to as CACOVID, began to provide additional support to the government. We have benefited from their resources, expertise, and network in both the public health response and overall response to COVID-19 pandemic. The third lesson is on transparency and trust. We knew very early that we had to be transparent with Nigerians and build the trust needed for the public to work with us in controlling the pandemic. We have worked very hard to be clear and transparent about what the government is doing. Since the first case was announced, NCDC has announced a daily update of the situation every single day and published a weekly situation report. We have provided several avenues for communication to Nigerians. We recognize that where there was a breach in trust, there was limited adherence to public health and social measures. Being transparent is extremely important in risk communications and promoting behavioral change. The fourth lesson is working on science, data, and evidence. The lesson here is that making decisions during a pandemic, we must be guided by science and data. The NCDC has continued to work very hard with states to improve the accuracy and completeness of key data sets that we use in making our decisions. Even when under immense pressure, we have refused to fly blindly and remain guided by science and evidence. The fifth lesson is on investments in health security. As I shared earlier, we were not as prepared as we would have loved at the beginning of the pandemic. But the resources we had were based on previous investments in the health security by NCDC. The first set of laboratories that began to test for COVID-19 in Nigeria had been testing for Lassa fever. The states where we had public health emergency operation centers had received support from NCDC between 2017 and 2019 to establish this. You will agree with me that we must do better in investing in health security, and the federal government of Nigeria has begun to work on this, such as through the Basic Healthcare Provision Fund, where NCDC is expected to be provided with 2.5% of the 5% of the funds earmarked for health emergencies. Let me now move on to preparedness for the future pandemics based on lessons from COVID-19. The COVID-19 pandemic has been unprecedented in several ways. It has affected lives, the economy of our country, travel, and social interactions. This has required a complete redirection of our public health resources to fight one disease. While building during a pandemic has led to the achievement of several milestones, there is no doubt that the world could have been a better prepared place if we invested more in pandemic preparedness. Therefore, we are seizing this opportunity, this moment of disruption, to build more sustainable and resilient systems for health security in Nigeria. Hard as it might be to focus on a future crisis while we are still facing the present COVID-19, the World Health Organization estimates we face a pandemic threat every 5 years. So we must be better prepared, and we have begun that process now. As most people may be aware, the world has been faced with a huge challenge of inequitable access to COVID-19 vaccines, with Africa bearing the brunt of it. While countries in Europe and America have fully vaccinated as high as 50% of their population in less than 1 year, African countries are still around 1% and faced with a scarcity of vaccines. The pandemic has created a sense of urgency around vaccine development and manufacturing in the African region. In Nigeria, we are taking advantage of this opportunity to fully establish our capacity for vaccine manufacturing. We have been working closely with BioVaccines Nigeria Limited, a joint venture between the federal government of Nigeria and Me and Baker Nigeria PLC. We are strongly aligned with the Africa CDC's target that by 2040, Africa should move from manufacturing 1% of the vaccines it uses to manufacturing at least 60%. Our country has the market size and the commitment required for this. Beyond vaccine manufacturing, we have leveraged on the COVID-19 pandemic to strengthen our health security. In about 1 year, NCDC has established at least one molecular laboratory in every state in Nigeria, completely digitized our infectious disease surveillance system, scaled up the establishment of state public health emergency operations centers in nearly all states, started the establishment of about 12 standard infectious disease treatment centers across states in December 2020, and building oxygen plants across the states and the Federal Capital Territory, Abuja. In terms of funding, we continue to advocate for more funding to NCDC as the country's public health institute, but also to other agencies of the Federal Ministry of Health for us to strengthen our primary health care system, medical research, pharmaceutical research and development, regulatory affairs, and other components that we need to be better prepared for the next pandemic. The responsibility is not with the federal government alone. We continue to appeal to state governments to invest in their health security. Investing in preparedness is not just a wise choice, it is good thinking. Distinguished ladies and gentlemen, and dear colleagues, when we are better prepared, we'll be able to do things differently and do it better. We are learning from COVID-19 to build back better. The pandemic is not over yet, and we continue to learn lessons. Today is a fantastic chance and an opportunity to draw on the experience that this eminent panel will share and put forward some big, bold ideas for now and the future. We remain very grateful for the support from Nigerians in keeping the COVID-19 numbers low. We cannot afford to give up now, as it is not over until it is truly over. The work that we are doing at the Federal Ministry of Health and our agencies is extremely important. But even more critically, our preparedness for the next pandemic not only starts now, but is already in progress. That is the assurance that I'm giving the listeners on this platform. Distinguished ladies and gentlemen, I thank you for your kind attention. Thank you.
Thank you very much, sir. Honorable Minister, appreciate the time taking, and of course, a lot of information there in that particular speech. First and foremost, I think it's only right to say well done to you and the whole team. I'm sure there's a plethora of people that you can't mention at this point. But before you go, sir, we do have some questions for you. I know you must be very busy, but we have a couple of people who are sending in questions online. As you all know, the tentacles of the Conversation Africa reaches Australia, Canada, France, Indonesia, Spain, UK, and the US, in addition to Africa. So we have a question here. Are you ready, sir, for this?
Please go ahead.
Okay, fantastic. So this one is via Twitter. It was sent in to the group, not from Nigeria. I just need to point that out. This is Dr. Catherine Kuyobotungi. Hope I got that right. And she says, how much is the Nigerian government investing in R&D, that's research and development for diagnostics, therapeutics, and vaccines, as part of its strategy for pandemic preparedness? What other practical measures in the country is the country taking to strengthen R&D capacity in the country?
You want to go on to other questions, or you want me to respond?
No, you can respond to that one. So we'll take it one at a time, sir.
Okay. Yes, Dr. Catherine, thank you very much for your question. It's a bit difficult for me now to give you the amount, in figures right now. But let me assure you that we are paying a lot of attention to that, and not just within the context of the Western world, so to speak, but even at the local level, because we have what we call TICAM directorate, or department in the ministry, which is TICAM is traditional, complementary, and alternative medicine. So there's a lot of research also going on in that area. So, and we have our institutes like the NIMA, which is the Nigeria Institute of Medical Research, and of course NIPRIT, National Institute of Pharmaceutical Research and Development. All these agencies are there, and they're working towards the same goal, which is research and development. But at this particular point in time, we are focusing a lot of attention on vaccine development. And you had in my presentation the collaboration we're having with BioVaccine Nigeria Limited, which is an agency. It's a private, it's a JV, it's a joint venture company that is working very, very seriously on how to not just have vaccines that the routine ones that we have, but also develop COVID-19 vaccine. So we are working in that direction, and we have every duty to do that in light of what is happening in the global in the global stage. Right now, a lot of countries in Africa, including Nigeria, can't even have access to vaccines right now. So we can only hope to get over that if we have our own manufacturing hub here in Nigeria. And that's what we are working towards achieving. Thank you very much.
Thank you very much, sir. I'll keep the spotlight on you. And for those of you in the webinar, feel free to send your questions via the chat. Those of you online, whether Facebook or Twitter outside Nigeria, also feel free to tweet at us. The hashtag is TCA Policy Dialogue. Hashtag TCA Policy Dialogue. This is from Marcos. He says, Honorable Minister, you said Africa would produce significant percentage of vaccines it uses by 2040. How will this be achieved, as this promise has been by previous administrations? Honorable Minister? Okay, I think we lost him for just a second there. I'm sure he'll be back. So please keep your questions coming in. Whether you're in the webinar, just type it and send it to me. Preferably, if you can let me know where you're typing or sending it from, just let me know your name and your location so that we can have a good spread of questions from across the continent and, of course, other continents as well. For those of you just joining us, great to have you with us. This is the first of many conversations brought to you by the Conversation Africa. And we're talking about Nigeria and the next pandemic, preparedness, response, and vaccines. We have a list of speakers and panelists whom you get to meet. I did a brief introduction of them earlier on, and we are very eager to take the learnings from this particular session and also to get a pulse of what is out there and how people are responding to COVID now and how the government is preparing for any other pandemic that might come our way. Now, as typical Nigerians, one of the first things that comes to our mind is to put a religious spin to it in terms of God forbid this will not happen to us. But I always say that let's do the work of science, which is the wisdom that has been given to us, and also prepare and pray as well. And somewhere in the middle, there should be a solution. Do we have the Honorable Minister back online? Just wanted to make sure. Okay, we have you back. Great.
Yes, he's back.
All right, sir. Are you there, sir?
Yes, I'm here.
Okay, I have a question from Marcus. He sent a question from the webinar right here with us. He said, Honorable Minister Mamura, you said Africa would produce significant percentage of vaccines it uses by 2040. How will this be achieved, as this promise has been done by previous administrations?
Well, thank you, Marcos. The popular saying that necessity is the mother of invention. And the necessity is staring us in the face now. In addition, where there is a will, there is always a way. We cannot afford to suffer what we are suffering right now again. And if that is the collective decision of governments and the leaders of government in member states of African Union, then that should be the way to go. So all we need is the commitment, the determination to make a difference, and we can do it, and we will do it. Thank you.
Thank you very much, sir. I do know you have another engagement that is being held up, but we would like to thank you for your time. We will take all your questions for those sending it in, and send it, of course, to the minister's team to have a good response. But thank you for the time, sir. On behalf of Conversation Africa, we really appreciate your time and your presence, and we wish you all the best in future endeavors, especially as it concerns COVID.
Thank you very much once again for inviting me. I want to send my best wishes to all the panelists, eminent panelists, they all are, and hope that at the end of it all, you will have gained so much, and will be willing to have the outcomes, in terms of write-up, and then we see what we can also do, from that outcome. Thank you very much.
Thank you very much, sir. Okay, so there we have it. We only have so much time, and we promised to finish this on time. So we're going to move very quickly to the next item on the agenda. Just wanted to confirm we have, is Professor Happy still here with us? Just to give a quick opening remarks, and if he's not, then we can move on straight. Okay, Professor Happy, great to have you.
Thank you.
Okay, so I'll cede the floor to you now, sir, for the opening remarks, and great to have you here.
Well, thank you. Mine is going to be very brief, and I want to say thank you to the organizers of this meeting, and I think it is a privilege to be, to be given an opening remark. Where your mentor is, and I refer here to Professor Tomori.
Okay, I think we're having a bit of a network issue there. I'm sure Professor Happy will join us very soon momentarily, but Professor Happy is a specialist, for those who do not know, I mentioned earlier on. He's a specialist of molecular biology and genomics in the Department of Biological Sciences at the Redeemers University. He leads the African Center that did the first genome sequencing on the SARS-CoV-2 virus. And I'm sure during the course of the conversation, you'll get to hear a bit of the work he's been doing. He's been doing some remarkable work with respect to producing vaccines himself and his team. I think there are 2 vaccines candidates developed by Professor and his team. And
sorry,
I think he. Okay, great to have you back. Go right ahead.
my video, maybe that will be helpful. In any case, I think it is very humbling to be here to present, give this opening speech in presence of this eminent panelists. I mentioned, Professor Tomori, my mentor, and Professor Sholagun Shade, who are the leaders in this field. So, and then when you talk, the topic today, is very, very, what I call, it's of actuality. And as such, it's very important that we have the discussion and then turn the discussion toward the future. So let's look into the future as we are discussing, and then as we're also closing, as we were ending this panel. So I will start by, first of all, talking about the situation in Nigeria. As we all know, we are dealing with a crisis. Probably we're faring better than others. As of today, well, as of June 28, we have about 17 new cases in Nigeria. Then we have 543, confirmed cases against 2,120 deaths. In terms of number of vaccines administered, we have 3,397,472. And this is in the total population of over 200 million. Now, and if you see the way Nigeria responded to the COVID-19 pandemic, Nigeria was privileged to have some kind of skeletal infrastructure in place in order to respond to COVID-19. Maybe a bit better than other African countries that had nothing. But the question is, could we have done more, or could we have been better prepared? The answer is yes. Were we better prepared? The answer is no, just as the minister actually mentioned. We saw the governments ramping up the treatment center starting from 3 to now we talk about over 100, what we call a diagnostic center across the country. So the question is, are these diagnostic centers effective? Are they still working? So these are very important questions. And this is the way I'll be going about my talk, mentioning areas and raising issues. And this basically to guide the discussion toward the future. Could we have more diagnostic centers? And are those diagnostic centers effective? Do they have enough reagents in order to do testing? Is the surveillance system in the country adequate? Are we testing enough in order to represent what is going on into the country? My answer for those is clear, is that we definitely, as a testing center, are testing, but I don't believe that we're testing enough, which means we could do more. Third, in terms of treatment centers, we had in the peak of a pandemic sometime last year, a lot of treatment centers that were active. But after a while the number of cases were going down, many of them got deactivated. Now, in a situation whereby we're having Ebola and COVID brewing in West African countries, I can give you the figures. My last interaction as part of the Africa Union COVID-19 task force member, infections in Liberia is up 1,166%. Infection in Sierra Leone is up 1,589%. And we have infections in other countries across Africa, over 2,000% in some cases. The question is, do we have what it takes if we have a surge in the country? Can those new centers be reactivated? And do we have what we call the human resources to face a surge like the one that is happening in India, in some other other African countries? We've done well in the past by sequencing the first genome in Africa, as the minister mentioned, or some of you mentioned. But then, do we have enough genome data, for instance, to know exactly what is going on in country? We know at the moment that we have about 45 different variants circulating in Nigeria. We've identified variants of concern. We've identified variants under investigations and variants of interest in the country. But the question that arises at this moment is, do we know exactly in real time what are the viruses or the variants that are circulating in different parts of the country? The answer to that is no. How do we, moving forward, correct these weaknesses and make our health system stronger? The health minister mentioned collaboration between the private sector and then the public health institutions. Is that collaboration still strong? And if not, how do we mitigate against such weakness? I'm looking forward. Do the public health system or the ministries and then the Nigeria Center for Disease Control collaborate strong enough with academic setups? We've seen that in the US, for instance, and in many countries in the world. the academic labs are contributing significantly to testing, to sequencing, and to providing evidence or the scientific evidence that an organization like NCDC need in order to make rational and evidence-guided decision. Are those collaborations strong enough, and are those collaborations supported in order to prepare Nigeria against future pandemic? The third thing I will talk about is, the other point I will talk about here is the over-reliance and over-dependence of Nigeria and many other African countries to the outside world. Right now, we depend a lot, and we depend absolutely to the outside world on diagnostics and on vaccines. And as the minister pointed out, that makes us very vulnerable. What can we do to prevent this? It is a good thing to say that while we have, the BioVac and the May and Baker PPP, program, is that functioning? The BioVac system, the BioVac and the Ministry of Health, a partnership is not new. It's been on for a long time. How come we're not prepared? And how come, we still at the point where we cannot produce vaccine for Nigeria? Do we need a new next pandemic in order to start getting getting BioVac up and running? Can we get BioVac up and running in the next few months so that, we should be able to respond to what is going on in the country? With the information that Nigeria had, we heard that Nigeria did so well, and then we have the NCDC. We had so many positive things from the minister. There are many questions that arise from that speech. How come with all of the information and the knowledge that is available, both within Nigeria and then in the diaspora, were we not able to produce a vaccine? Were we not able to produce diagnostics? Were attempts made to produce diagnostics or vaccine in this country? The answer is yes. Was that move forward? The answer is no. What happened? Preparedness against future pandemic will rely a lot on the ability of Nigeria to be able to produce its own vaccine and its own diagnostics. If that is not done, it's going to be all mercy. So therefore, there is a need to accelerate those processes and to work with the academics and then the private sectors within in order to make the country better prepared. We're talking about preparedness against the future, and let's look toward the future. What would Nigeria need in order to prepare against the future pandemic? The country will need to rally all its forces together, both in the public health, in the private sector, and in academia, coming together and coming out with a framework that can prepare the country better. There are many programs and projects already being piloted in Nigeria, like early warning system for pandemic preemption and response. Can the Nigeria, through the NCDC and the government, leverage such initiatives in order to strengthen the health system and prepare the country better for pandemic response? Finally, as the Honorable Minister of State mentioned, it is very crucial, looking forward, that Nigeria invests a lot in health security, not just speeches, but action and real investment. And more importantly, it is crucial and very critical for Nigeria and Africa to invest in vaccine security. It is, I will say, dangerous for a country of 230 million not to have a single facility that can help provide vaccine in case of emergency. It is dangerous for a continent of 1.3 billion people not to have vaccine production facilities that can help a continent to respond to an epidemic or to pandemic. Yes, recently or 2 or 3 days ago, South Africa, or last week, South Africa announced a new initiative supported by the World Bank and WHO. That is a step in the right direction, but a lot more has to be done. I really want to end up this with all of these questions and challenge the panelists as we want to get into the panel discussion to provide solution and prefer answers to some of these questions so that together, by the time we gather all these answers, we could make some suggestions to governments so that we can move not only Nigeria forward, but also Africa forward. Thank you.
Thank you very much. And very, very profound stuff you said. In fact, very insightful. And I think that is the right amount of energy and direction that we need for the panel session that will commence. For those who just joined, thank you for being here. That was Professor Christian Happy that you just heard. And he's a specialist of the molecular biology and genomics in the Department of Biological Sciences at the Redeemers University. He leads the African Center that did the first genome sequencing on the SARS-CoV-2 virus. And he has basically set the template for the next session, which is why we are here. We're talking about Nigeria. That's the theme, is about Nigeria and the next pandemic: preparedness, response, and vaccines. Please do not forget to throw in your questions in the chat room, or if you're streaming via Twitter or Facebook, outside Nigeria, that is with Twitter, please let us have your questions. You can either tweet at us or use our hashtag for the day. And the hashtag is TCA Policy Dialogue. That's one of the hashtags. And we also have another one for you, which is that's TCA African Dialogue or TCA Africa. That's 2021, depending on which tickles your fancy. I see some of the questions coming here. Adebayo, I see you. Agina, I see you. Thank you very much for throwing in your questions as well. We have a team going through some of the questions, so if I don't mention your name, please be rest assured that we have people working on this as well. Kingsley, I see you. Seminu Okonlawon, thank you very much. Professor Nnamdi Madichie, thank you very much as well. So I'll quickly reintroduce our panelists. I mentioned them earlier on at the beginning of this event. Please, could you turn on your cameras? That's to our panelists. In no particular order, I would want to please do make welcome once again Professor Folashade Ogunshola, who is a professor of microbiology. She's the first woman to be appointed as provost, College of Medicine at University of Lagos, and later deputy vice chancellor and acting vice chancellor. Thank you very much for being here, Ma. We have Dr. Doyin Odubanjo, a public health expert and executive secretary, Nigerian Academy of Science. He was involved in the management of the 2013 Ebola outbreak and the 2020 COVID-19 outbreak in Nigeria as well. We have from South Africa, Professor Gray, who is the president of the South African Medical Research Council. She is a member also of the Academy of Science in South Africa and chairs the country's standing committee on health. One might say she's a very healthy woman. Professor Oyewale Tomori is a world-renowned professor of virology with more than 40 years of experience. He's led research into the study of several viral infections, contributing significantly to research in polio, Lassa fever, and the Orungu virus as well. And we also just had Professor Happy. So can we have all our panelists' cameras on? And I have a couple of questions for you as I move into my moderating cap. For those of you at home or wherever you are in the world, please feel free to send in your questions either in the chat room if you're part of the webinar, or you can tag us on Twitter and of course on Facebook as well. Due to time constraints, we have roughly about an hour. I would encourage that we keep our responses as briefly and to the point as possible. They're just guide questions. And if there's any other contribution you'd like to make or insight from your specialty and your field, we really appreciate you doing that as well. So I will kick off with, let me see, who should I kick off with? In no particular order. Let's go to South Africa, our brothers and sisters in South Africa. So I'm going to put the spotlight on Professor Gray. How are you, Professor Gray?
Greetings from the south to the north of Africa.
So to speak. Thank you very much for being here. So very quickly, I just wanted to find out how has South Africa managed COVID-19 so far, especially in terms of research and development?
So I'm not sure if you can hear me. How is the
yeah, I can hear you.
Can hear me. Okay, great. So South Africa has had a devastating COVID-19 pandemic, and we seem to be the country that has been mostly affected, and there may be lots of reasons for it, our demographics and maybe the movement of people in and out of the country. But we've had 1.95, almost 2 million people infected with SARS-CoV-2, and we've only been able to vaccinate 3 million people in South Africa. So we are very behind on vaccinating. At this moment in time, we're in the third wave in South Africa, and this is led by the Delta variant. We had a variant of concern, which was the Beta, which it seems to be higher. The third wave seems to be peaking much higher than the Beta variant. And at this moment, as I speak, we have a lot of people dying. We're running out of hospital beds, running out of human resources, running out of oxygen. People are waiting in their cars for a bed and getting oxygen in their cars outside the hospital. So a horrific situation in South Africa. So let me just turn to show that we have a very bad one. Excess deaths are 3 times much as reported deaths, and so we do have a lot of burden of disease in South Africa because of the pandemic. But what did we do in terms of research, and how did we respond, or how did we try and respond to this? So very early on, when we heard the first case of COVID coming up in South Africa, we set up a research agenda for the country. So we had a research agenda. Mostly it was around surveillance and diagnostics at that time, molecular surveillance. And then also we started to look at therapeutics and vaccine approaches. We also freed up public funding. So we looked at our budgets. We went to the Treasury and we created money for research, which we rapidly moved to the scientists in the country. We collaborated extensively. So this is the first time in South Africa. Usually South Africans are highly competitive. They work in silos and they don't like to work with each other. And this is the first time all scientists got together and started working together. We had collective calls. We have calls all the time. We have working groups, technical working groups, and we have a program of scientists, clinicians, basic scientists, and molecular biologists who all work together and try and see what we can do. So we also set up a lot of relationships. So besides freeing money in South Africa, we set up relationships with foundations in South Africa to free money, particularly to expand testing at the time when we didn't have enough testing in South Africa. So the Solidarity Fund funded a lot of research and also funded the implementation vaccine trial that we did amongst healthcare workers. Alma Foundation, as well as the Dell Foundation, supported a lot of the research. We set up wastewater surveillance systems, and we had a lot of collaboration in South Africa. What was critical was setting up our surveillance, both the clinical surveillance as well as the molecular, and that's enabled us to track the variants of concern over time in South Africa and being able to discover the Beta variant, and then to understand why we had a third wave looking at the Delta variant. And so we agree with our colleagues in Nigeria. We need to make sure that we are not left unprepared for the next pandemic. We need to understand why we don't have enough manufacturing capability in Africa for vaccines. It is ridiculous that we have a wonderful and thriving, potentially thriving continent, and we don't have entities like the Serum Institute. So we are looking at that. We have a BioVac. We have a public-private partnership that basically has done fill and finish. And we also have another generic manufacturer called Aspen that also does fill and finish. But we haven't developed the full tech transfer of vaccine development. And hopefully with the Cyril Ramaphosa, our president, and the WHO announcing the beginning of a vaccine production potential with mRNA starting in South Africa with collaboration in the rest of Africa, Africa can then start to invest in its own biological and manufacturing capability. What we have learned from this pandemic is science is not a luxury. Everyone thinks science is a luxury. We don't fund it enough. We don't give enough money to research. And if we don't have science, we can't respond. And so a good lesson for us in Africa is that we need to make sure that the public purse funds science and funds innovation, because if we don't have this, we can't respond in an appropriate way to the pandemic. Science is not a luxury in Africa. Science is not a luxury when you're poor. You have to use all the tools. And if we don't have science, we can't react in a timeliest fashion to the changing epidemic or to understanding the burden of disease. We've neglected therapeutics, and we need to make sure that we do that as well. So I'll stop there.
All right, thank you very much, Professor Gray. I mean, that was quite packed. We might not. I mean, in Nigeria, to the best of my knowledge, we don't really have like a serum institute. You suggested that, but I think I'll hand over or go over to Dr. Odubanjo. He's a public health expert and the executive secretary of the Nigerian Academy of Science. He was involved in the Ebola outbreak and also the COVID. So my question to you, sir, let me just put the spotlight on you, is along the line of what lessons has Nigeria learned from this pandemic, and in your case, the Ebola as well, in terms of investment in research and development, sir? How can we catch up with the rest of the world?
Well, thank you. I like the phrase by Professor Gray, science is not a luxury, in Africa. And I think clearly that COVID-19 sends across that message very clearly, in terms of the fact that the epidemiology of the disease is varied everywhere, and indeed in Nigeria. And that tells us we need that local research. We needed to find out locally effective therapies. We needed to find diagnostics, as Professor Happy said earlier. We need to look at local vaccine capacity so that we also can reduce the vaccine hesitancy, because if it's produced here, there's more faith. So I think the way to improve things is that policymakers and decision makers have to engage better and more with researchers. We need to build that synergy. There's that science policy gap, and there's that kind of mistrust between them, where the scientists believe the policymakers don't understand and don't care. The policymakers think the scientists are talking highfalutin and technical jargon, and they don't quite understand the realities on the ground. And we need to bridge that relationship such that they develop trust and also dependence on each other to deal with issues, so that when the scientist is talking, he understands the other side, and the policymaker also understands the need for science and how science works. And I say that with emphasis because sometimes, again, the policymaker wants to put in some money and wants results in 2 months. He wants his answer in 1 month. We got a request at the academy now asking for input into a strategy document in 3 days or so. And that's a bit ridiculous. You're not, if you get anything, you probably are not getting what you should get, but so there needs to be a bridge. We need to note that, the economic plans are a waste of time in this day and age without the input of science. So we have, for instance, the National Economic Committees in Nigeria, but we don't have scientists on board. We don't even have the Minister of Science and Technology there, not to talk of the President of the Nigerian Academy of Science. And yet we'll come out and give speeches that say that we know that science, technology, and innovation is what drives economy in this day and age. So we need to really put action to those words that we say. And I say also that based on COVID-19, and indeed we saw it in Ebola, that we realize from COVID, the minister mentioned, for instance, that we need the private sector very badly. We need the private sector very badly to get things running, because there are some things, apart from the money, there are some efficient systems that the private sector can bring on board to help us manage our public health system. I think I should just stop there for now in the interest of time. Thank you.
Thank you very much for that, sir. I'll come back to you very quickly, but there was something you touched on. I just want you to just hammer on that. Now, in your experience, if you were to put in one word, the most frustrating aspect of this whole ecosystem, what would that be for you based on what you've seen? What is that one thing that if you could solve, with a snap of a finger or with a direct call from the president, what's that one thing, sir? It's
communication. It's a rather simple thing for me to answer. It's communication. I think we underestimated, what we need, what is required. We've spoken, and by no means am I trying to undermine the need for vaccines or laboratory testing and all of that. But the one thing that I said, and I believe from the get-go, is that what you need more than anything is behavioral change management. What you need is get people to do what you need them to do, including testing, because you can have the testing capacity, but the people will not go to the labs. You have the mask as a curtailing measure, but the people will not put them on. So we were depending more on using law enforcement instead of understanding that we needed to be able to communicate effectively in order to get people to change their behaviors and follow whatever the directives are that we give for their benefit. So I think that is missing, and that links to trust. The minister mentioned trust and transparency, that there's a linkage to that. And I admit I'd been linking and talking to the communications unit of the NCDC consistently throughout this period. And I keep telling them, you are perhaps the most important unit, but I know that people will not know that. And even within your organization, you will not get that. Yeah.
But communication will not get that. Okay, thank you very much. So we lost you for a second, but I think the gist is very much Pastor Clutch. You mentioned communication, and for academia, and basically one would say that starts at home, but also in the school, the institutions. And that means I'll be heading over to Professor Folashade Ogunshola, who is a professor of medical microbiology. She's the first woman to be appointed as provost at College of Medicine at the University of Lagos, and later deputy vice chancellor and the acting vice chancellor. Great to have you here with us, ma'am.
Thank you very much. Let me also mention that I was involved with the outbreak, the Ebola outbreak in 2014. I'm presently on the Africa CDC COVID-19 task force. Concerning communication, I think you can only communicate what the facts that you have. And I think some of our greatest problems is data. I loved what Dr. from South Africa said. Science is not a luxury because science generates the data that you will communicate. And we don't have that. We talk a lot about research, but research requires that is a long-term investment, and we have shown that we're not very good in long-term sustainability of things. The greatest problem we have is that our systems around health and education are broken. If you're going to do research in health, it requires knowledge. It requires that you have strong educational systems. It requires that you have strong healthcare systems. What we have seen across Africa generally is that we have a reactive approach to health rather than a proactive approach to health. And the proactive is where you have the research, the investments in manufacturing, the investment in human resources. And these are things that you do not suddenly, they're very capital intensive, but it means that you have a long view. What we want is a very short-term reaction. We want the answer yesterday and now. So we talk about research, but we don't fund it. We talk about research, and sometimes the academics bring it up. Let's talk about Professor Happy's the vaccines. But there is a gap between doing the research, having the product or the prototype, and commercialization. And that's where government needs to come in. What's the encouragement when we've done the research, you have a product? Taking it the next step requires government, requires the private sector, and requires a policy framework that helps to drive that. That's very missing in Africa. Essentially, people talk about research as if that's it. And I think from my point of view, you only communicate what you're doing and what exists. And it can only be authentic when people can see the value of that it's really impactful and that it's for their benefit. Nigeria has a broken system around healthcare and education, and people recognize that. So when we talk and pontificate, they don't believe us because on the ground, where's the healthcare? Because really, fundamentally, before we can start talking about preparedness, preparedness builds on a system that's working, and that system is broken. So if we're really going to prepare for the next pandemic, or we're going to get the trust, we have to build the systems and make sure that they're strong. We need good health systems. We need good educational systems. Thank you very much.
Thank you very much, Ma. I mean, it's very, very loaded, what you said. I'm sure, even judging by the questions that are coming in, a lot of people will want to obviously point to the government. I love what you said about science generates the data you need to communicate. And for the data to be generated, funding is required. And a lot of people share the opinion that a lot of the funding, which is readily available, has been diverted to other, would I say, quote unquote, less important ventures, because without a healthy nation, there's no nation to rule. What would be your stance on this in terms of how to get the funding? Do we rely on the government, or do we go the COVID route, or is it a hybrid of the two?
I think it's very multifactorial, and I think this question is one that I think there's still government alone. But I don't think it's just even funding alone. Dr. Duban just said something that when government is talking about research and researchers are talking about research, we're really not necessarily saying the same thing. We need to have a lot more discussion about research, because when people talk, just go and do research. What does that mean? And even for the academia, there is a sense that we are separated from what's going on in the policy arena. And so we need to have a coming together with serious discussions. I know the government has set up through Tech Fund research a group to be looking at the problems of Nigeria. That's a good step, but it's not adequate. The issue really is how much is government using its institutions? And I don't just mean the Nigerian medical research. We've set up universities. How much are we using them and giving them the challenge to do these things that they're set up to do? We don't. I'll just give a little history. We had PEPFAR for years in Nigeria. We had the AIDS epidemic, and during that period, loads of money came in. How much of that went into our institutions? What we did was set up parallel structures, which we did again in COVID. Imagine if all the money that came from the private sector was used to set up and strengthen the healthcare facilities to do what they're supposed to do. Even when this is over, those structures will remain. The people you have strengthened, the system you have strengthened. But what we do is we set up parallel structures. And I think as a nation, we need to start looking at this again. When we have these epidemics, which can really be a springboard, how much are we thinking of what the monies coming in can be used to improve the system we have so that our tomorrow is better? We don't. We just set up parallel structures. We look at it on the short term. We do things. I mean, we need to do a bit of that. But I see us not even attempting to really strengthen the systems. I saw it better in COVID than I've seen it in other epidemics. So maybe we're beginning to learn. And I guess part of that really was that COVID is affecting both the rich and the poor. And so everybody was trapped here. So we had no choice but to, start looking at our healthcare systems and start to at least add some funding to them to strengthen them. So I think that issue of research in terms of preparedness is going to be a long conversation. But there are many things. I think we need to decolonize. We need to, in our thinking, because we're always looking outwards. We're always looking to experts from everywhere. But it's the experts in here that live the problems, that really understand the context of our problems. And we have very trained manpower. What we need to do is use them. And we need to do that in between epidemics so that they are also ready for the next one. Thank you.
Thank you so much for that. That is, I mean, I had a lot of takeaways from that particular one. I'll summarize them, but I need to go over to Professor Oyewale Tomori, a world-renowned professor of virology with more than 40 years of experience. He's led research into the study of several viral infections, contributing significantly to research in polio, Lassa fever, and the Orungu virus. Now, good morning, sir, just to make sure you're there.
Morning, I'm here. Can you hear me?
Yes, I can. Is there a chance of us seeing you, or we still want to?
As I told you, my modem is quite slow, so just leave me as I am. Otherwise, you won't see me at all. You won't hear me. Okay. So let me just talk. Don't worry about my face.
Okay, sir. No problem. So I wanted to find out from you, sir. I mean, over 40 years, you've been through a lot of these, I call them pandemics. What has been, in your opinion, the gaps and the gains? So, for example, Professor Ogunshola mentioned that we're constrained and forced to make it work for COVID, and that's because we're reacting. We're not being proactive. But in all your years of experience till date, what have been the gaps and the gains of pandemics in the country generally?
Thank you very much. And I think I'll spread it also to Africa. So what I'm saying about Nigeria probably goes for most of the African countries, except a few. The Honorable Minister came and scratched the surface. And you had this thing. What you didn't hear is what's in between. The devil is in the details, not what the minister said. Maybe Christian Happy came in and opened up a little bit of the details. And then Folashade followed with this thing. I'm going to the roots. Two things I would like to make before we start saying the same thing we're saying. First of all, we learn lessons and forget them as fast as we learn them. That's the first problem we have. It's not that we're not learning lessons, but we forget them almost immediately. Each time we boast about the 2014 Ebola, whatever Nigeria did, what followed in 2015? What followed in 2016? We had Lassa. It got worse in 2016, got worse in 2017, got worse in 2018 when it became, we thought was the worst, got worse in 2019. This year we're getting less, because not because it's bad, but because COVID has covered everything. So the only way our preparedness, is measured by how far the difference is between the epidemics. We prepare now. I mean, you can only prepare as much as your response depends on how well you prepare. And the longer the spaces between the epidemics, the more we forget what we learned, and therefore we come to scramble. The minister told us Nigeria started build up laboratories. We shouldn't be building up laboratories now, 60 years after independence. And that's what I told her this thing. So if we started with 2, we should be ashamed of ourselves that when COVID came, we only started with 2 laboratories. 60 years after independence, we shouldn't be talking about that. And we are counting those ones as successes, when we should be ashamed of all those little things. So year in, year out, we're having that problem. Secondly, the whole of Africa itself, we're disunited in Africa. Our leaders are controlled by all those things. Now there's a frenzy now to build a COVID vaccine all over Africa. Hub here. Years ago, the African Vaccine Manufacturing Initiative set up a committee that was looking at this issue of vaccine production in Africa. And they were talking of regional setups. Not every producing the same vaccine, but different vaccines, so that if A produces one type of vaccine, all of Africa will buy. What are we getting now? The European company is coming in and disrupting all those things. Africa is running helter-skelter. After getting money from Europe, getting money from this, getting money from that, and becomes a bilateral relationship. When Senegal produces this COVID, who is going to buy it? What's the population of Senegal? So even the things we've done in the past for our own good, we are allowing other people from outside to do with us. Finally, I mean, I just want to talk about this thing. One lesson you talk about history or stories. Let me give you a good story about what is happening. Take the so-called green pass from Europe, when they said if you don't use my COVID vaccine or whatever, then you don't have a green pass. And people were saying, oh, the Europeans have been this. I said, no, you are the one that is, sorry to use the word, you are the one that is the fool. You are the one. Europe is not discriminating against Africa. He's saying the same thing for China. He's saying the same thing for India. But what did India do today? India got up and said, if you don't use my COVID, you can't come to my country. If the so Europe now has to come back on the bargaining table. When we are talking about COVID vaccine diplomacy, when you bring nothing to the table, you get a rotten deal. And that's what we are getting in Africa. We are bringing nothing into the discussion. And that's where we are. Today, India can argue with Europe and say, okay, I don't want to come to your country, but none of your people will come to my country if you don't use my COVID. That's where the strength comes in. And that's where all our colleagues have been talking. Invest in your research. Invest in those other things so that you don't become, you don't become the ball that everybody plays around. Nigeria is putting money into some of those things. What kind of money are we putting in? You don't have a foundation. You are putting money into research. Central Bank came up with I don't know how many billions to do research, and they put 600,000 here, 1,000 here. Over what? You don't have the foundation for doing the research. Where are they going to do it? These are the basic issues we are not. Why won't be bent? His legs are knock knee. So you address not the luggage, you address the knock knee. That's the thing, and that's the problem with Africa. We've not been addressing those basic foundations with problems we had since 1960 years of independence, and we're running again at that skelter. We have a few African leaders, like Ramaphosa in this thing, who are proactive. There are four groups of countries over preparedness in Africa. There are not Africa, there are the proactive countries. Those are the European countries. Even before the vaccine came, they went out and took a gamble and bought, not just one, they bought in different places in case one or two would not work. There are the inactive countries. Nigeria is not even among the inactive countries. The inactive countries are the ones who were waiting for donation. When donation did not arrive, what did they do? They went and looked for vaccine themselves. Then there are the no active countries like us in Nigeria. Even when the donation has not arrived, we're still not looking for vaccine. How can you prepare? Let me stop there before you. So let's stop pretending amongst ourselves and bringing all these theories. The reality on ground is the fact that we are not doing what we should do. Over.
Thank you very much, sir. One cannot ignore the passion in your voice, and I really appreciate that. After over 40 years, you're still very driven, and appreciate that. I'll move over quickly back to Professor Gray. I wanted to touch on the issue of collaboration based on your experience so far. And I'm just going to put it very bluntly. Have there been any Pan-African collaborations that you know of in recent times to tackle this? Like Professor Tomori said, has there been synergy between African states that you're aware of that works?
Not enough. I don't think there's been enough collaboration. I think we need to build trust in the continent. There's been some bilateral support of various countries, but we haven't, as a continent, thrown all our scientists together to collaborate in an effective fashion. So some synergy, but not enough. We need to demand more collaboration. We need to demand more work on trust between countries, and we need to make sure that we don't put our own personal interests at heart, but look at the collective of Africa. So I think it's time that all African scientists work together. We have brilliant African scientists on this continent, and we need to work together.
Okay, Professor Happy, would you like to chime in on that as well? Let me just give you a quick second to get your camera on. For those joining us, great to have you here with us. The questions are coming in, so please send in your questions either to the chat room, or you can tweet or on Facebook as well. We're streaming this live. Thank you to all of you who have done so so far. Professor Happy, yeah, I just wanted you to touching on that in terms of the collaboration and what exactly is holding us back as a nation or as a continent.
When you talk about collaboration, can you collaborate in Africa? The answer is no. How is it easy to move from one African country to the other? How do you collaborate in that context? I think our leadership reinforced so hard the colonial, what I call immigration laws and rules, that is practically impossible to talk to the next scientist to the next door. So, and in a continent whereby you cannot move banana from one country A to country B when country B is suffering of hunger, how do you move even vaccines or diagnostics if you produce them? So I think, it is a shame for Africa that having sat down in Berlin in 1884 and divided this continent on the table, Africans actually took that and ran even further with that notion than the colonial masters, and this is post-colonialism. So how do you think that you can collaborate in this continent where it's practically impossible to move from one country to the other? We're talking about African Union. There is no unity in the African Union. Let's be factual. So how do you work in a place, in a continent whereby it's easier to move, to jet out of Africa and go and share knowledge in Europe and America than to go from one country in Africa to another? Collaboration is practically impossible. Assume for a minute that we had a vaccine that we have, and then we want South African expert, we want expert from Uganda or Kenya and some other countries in Africa to come together. How easy is it for them to obtain visas, for instance, to either move from Nigeria to South Africa or from those countries to Nigeria to come and sit down and collaborate? So these are just facts, and then this is profound. We shouldn't just be fooling ourselves and say that we are preparing. Break down these barriers, break down these silos. You can't make progress if you don't break down all these barriers and silos. And all of this is actually due by, our leadership, that have failed us completely. We are here today talking about preparedness and vaccines and everything. I asked the question in the beginning, did Africa make an attempt to develop diagnostics and vaccine? The answer was yes. Professor Atomori alluded to it. Where are we with it? We refuse deliberately to believe in ourselves. And in order to, and then we are just so good at begging and good at just waiting for others to come and give us a solution to our problems. Professor Ogunshade alluded to that. We have enough resources both within and in the diaspora to solve our problem. But do we believe in ourselves? I think we've gotten to a point whereby we've been told so many times over the past how many decades that we're good for nothing, that we don't even believe in what we can do. So the truth of the matter is, there's a need for Africa to reinvent itself and to refund itself. And it's only by breaking the silos and the barriers that we can actually come as a people and collaborate. Even within the country, do you see collaboration within institutions in the country? When I talk about collaboration, I'm talking effective collaboration. No. How can you have research and find solution to problem and then to even future pandemic when institutions don't talk to themselves? When people, are rather guided by ego than scientific, merit, and where people can agree to come together to work to solve problems than to say it is the I syndrome. So these are issues, and I think it's very important that at this stage, looking forward, we should try as much as possible to break down our barriers and our differences and come together and address problems, African problems within Africa, with African perspective, and take into account the reality on the ground. Thank you.
Thank you very much for that, Professor Happy. I think you hit the nail on the head. And if there was going to be a takeaway from this, for me, I've seen that communication is at the foundation of the structure that we need as a continent. Once there's communication, then we can effectively either maybe raise the funds or create the institutions or reinvent or revitalize the established institutions that are meant to address such issues. And from that level, you can move on to effective collaboration, exchange of data, information. And once there's a solution, I think it makes your case a bit stronger. And when it comes to issue of collaboration in other sectors, for example, in entertainment, in the music sector, we've seen that, and Nollywood, for example, we've seen how the sheer force of the drive and the will for Africans to move beyond the restrictions of the government, beyond the restrictions of borders, with the use of technology. And I think technology has a very large role to play in all of this. But with that said, thank you very much to all our panelists, and just want to give a quick shout out to our partners. The academic partner of this particular conversation is the Nigerian Academy of Sciences. We also have media partners. Thank you to Punch Media Foundation, News Central, and Nigeria Info for this. I think one or two of them are streaming this conversation live as well. So we're heading back to our Q&A for the next 15 minutes so that we can hit our target of 12 noon. It has been quite an engaging conversation, infectious, if I can use that word. And the points being made here are extremely, extremely important. As a citizen from the outside looking in, you will think that with all these monies being mentioned in all these countries and all these vaccines being produced, that there will be a backdoor synergy. But it's very obvious from this conversation that every country on the continent is just going on their own, trying to solve the problem on their own. And one will take the adage of the broom. The broom, if for those who know the broom, the traditional broom, one stick cannot sweep a room, but when the sticks come together, they form a thick broom, which is more effective. And I think the collaboration is one that one needs to really look into. And of course, this conversation is brought to you by The Conversation Africa. We have going straight into the Q&As. If your question is addressed to any particular speaker, please highlight that in your questions, and the team putting together the questions will get to me as well. So this is from Facebook. Maybe for Professor Folashade, the question from Farzane Berozi. One source of key data during the pandemic has been excess deaths. Is this data available for Nigeria? Okay, so let me just turn to, you can highlight Professor Folashade for that one.
Thank you. I can't start my video, but I'll answer.
Oh, okay,
we don't. Okay. Thank you. We don't have the data for deaths. We don't have accurate data for deaths. However, it is quite clear that we don't have that kind of excess mortality that you're seeing in Europe and the US. And the reason in most of Africa, I'm not saying we don't have any, for example, in Nigeria, we don't have that kind of excess mortality. And I'll explain why I said so. If you have the excess mortality, it is obvious. You can't hide it. So what you might not have is people attribute it to COVID. They may not attribute it to COVID, but you will see it. So, but we're not seeing that kind of excess mortality. In fact, there was some data that came out last year and that did not show that much. There wasn't a major increase between our death rates from 2019 to 2020 at that time. Even till now, you don't have anything massive. So we don't have accurate data, but we also don't have the kind of excess mortality. I want to remind us that when there was some mortality increases in Kano, the grave diggers screamed. So they didn't know what it was about, but they knew something was wrong. So we're not seeing that. And the reasons could be numerous. I have a few ideas about that, but we don't have that kind of excess mortality in Nigeria.
Okay, thank you very, very, very much for that. Personally, I've always been, I can't scientifically prove this, but in the slums of places, at least to the best of my knowledge in Nigeria, in Lagos, you find out that a lot of the people, they really even don't know what is going on with COVID. They're going about their businesses. They're not affected. Some are theorizing that, this COVID is for, the upper class, the rich. What's your take on this from your experience so far? And then I'll move on to the next question.
Okay. I'll say this. From the data that exists, clearly infection is going on. But they're not coming down sick, and hospitalization at that level is not happening the way we were scared it would happen. And one of the things that, in my mind, I haven't got the data to prove that, is that if you think about the people in our slums, many of them live outside. They're not living, even though they're in those little rooms, is somewhere they go to do things, but you find them sleeping on their corridors, they're even in the markets, they're in the open air. And my suspicion, it's a suspicion, is that if you think about it, ventilation reduces the aerosol concentration. So they are getting infected, but not by concentrated aerosol transmission. So they get enough to be infected and probably develop some immunity, but not enough to get sick. Then when you change that to the elites, we're sitting in air conditioners, closed windows, Any COVID in the air is concentrated and recycled. It's not going out. Air conditioners don't. There's no intake of fresh air. So we're sitting in closed systems, and you'll see that our rates there are much higher, of coming down with hospitalizations. I mean, it's not an exact thing, but it's just one of the things. There may be other reasons, but that's one of the things that comes to my mind. Lifestyle.
Fantastic. I've always wondered. I've always wondered as well. So I'll be getting rid of my air conditioning now in a couple of minutes, and I'm going to throw open the windows. We have here from Natasha. This is Natasha. The speakers have eloquently outlined the challenges, but as eminent personalities and influencers in their sphere, can they also share the solutions? Are there practical means to be implemented within academia and research to incentivize Africa collaboration, for example? I'll throw this question open to the floor. Is there anyone that is willing to, any of the panelists that is willing to address this one?
Can I make a quick comment on that?
Yes,
this is Tomori. I think we all keep looking for solution. The solution is in us. It's in me, it's in you, as an individual. When we keep talking, I saw another question when somebody was saying, the minister, professional they become government people and do the same thing. It boils down to you. It boils down to me. It boils down to what I would do. As a professional, I will not go into, first of all, I won't be a minister. But if I were a minister, I know I won't last. Because I will stand by my own conviction. Many of us who are here, sitting down here, and many of us, when they got down to brass tack, when taking the right decision, we'll take the right decision. So let's not shift the point to politicians and all things. On your individual space where you are, what are you doing? That's the question we should be asking ourselves. I mean, the leadership, the other day there was a story about one Merkel, when she finished, the entire city of Bonn came out clapping for her because of her individual activity. You as an individual, and the people who are asking the questions, what are you doing where you are? These are the questions you'll be asking ourselves. And so throwing it to a public thing. Do something. Literally doing the oasis or whatever, we spread out to become the ocean that we want it to be. 40, 50 years we've been at this thing. I've not changed my mind. Have you changed your mind in your own place? These are the questions you'll be asking ourselves. Start turning around and asking people, well, what is the leader going to do? Over.
I completely agree with you. I mean, just to taking an example from even Dr. Stella Adedevo, and God bless in loving memory, where she took a stand. It's all about individualism, and I think in Africa we're used to wanting to push the buck to the government without realizing that the government is made up of people like you and me. So I completely agree with you on that one. I think somebody else wanted to speak.
Yeah, I just wanted to say that the quickest way to get people to collaborate across the countries that we found is to have to put money on the table and to have a joint request for a grant, so that basically scientists are forced to collaborate. So what we usually do is we work with other countries, and we both put money aside, and we do an RFA and say this is what has to happen, and then scientists are forced to find collaborators in the other country and submit a competitive grant. So that's been one way that we've been able to build relationships and collaborations between scientists by getting them to apply jointly for research grants.
I want to be the devil's advocate in this instance, and I wanted to ask this question. Africa is a very unique continent in terms of our mindset. We always make reference to a lot of European ways, but their mindset is completely different. Africans sometimes feel entitled. There's the issue of ego. There's the issue of tradition and culture, where a certain culture or group might not want to work with another for whatever reason. Do you think this will be a stumbling block in terms of the collaboration on the continent?
When there's money on the table, everybody will work together.
Some might argue that if there's money on the table, people might not work together. But anyway,
if it's conditioned to access it, then they'll work together. So people put aside their egos when the conditions of the grant say that it has to be collaboration. you can force the collaboration by doing these kind of grants. They really have worked for us in South Africa. We've been forced to work with BRICS. We've been forced to work with Sudan. We've been forced to work with the UK, with America, with Zimbabwe. So it has worked. We've made our scientists go and find collaborators in other parts of the world. So let's do a Nigerian South African collaboration. I'll put some money on the table and you put some money on the table, and we'll do a joint RFA, and we'll get our scientists to work together. For goodness sake, the North and the South.
I'm looking forward to that. I'll bring the food. I can
add to that and say it works very well for South Africa because South Africa knows how to fund research and education. So because you put the money on the table and order people to put money on the table, then you have collaboration. In many other African countries, they don't put money on the table, and therefore, when you want, you want joint funding, you expect others to put equal money on the table. And what happens when that doesn't come? Then you have a situation whereby that collaboration is skewed in one direction, and as such, you can have equity in the whole process. So I think in this saying, we're looking forward. African countries, as you mentioned before, research is not a luxury. African countries should understand that their security and their future is actually about bound in funding research so that solution can be preferred to the problem that is actually plaguing their economy, plaguing their health, and plaguing their development. So clearly, it's really, collaboration can be very easy if countries decide to invest into the areas where you want people to collaborate. Thank you.
Thank you very much, sir. Okay, yeah.
Yes, I just wanted to add on to that, or should I say just sort of bring that together, that one of the greatest problems I think we have, and which we need as African countries to go forward in, is to recognize that putting money in research is the greatest preparedness that we can have, because it's going to find out what our problems are, get the solutions before the crisis occurs. Not when the crisis occurs and then we start talking of short-term preparedness. This is the real preparedness that strengthens all our institutions and makes sure that we don't have too many crises. And I think that's the sort of discussions we need to be. Also, let's say to all of us, imagine 1 billion people buying your goods. We need to break down those barriers between African countries, and we need to decolonize in our mind. That's the problem. Thank you.
Thank you very mumuch. Thank you very much, Professor. We have a quick comment here, more like a contribution. This is from Catherine Koyobotungi. Hope I got that right. I hear the frustration among the panelists about how we need to do more as Africans. Other than political leadership, Africa has many stakeholders. We are all Africans, and some solutions will have to come from us, academics and scientists, as well as everyone else. I completely agree with you, Catherine. Thank you for that. I think there's this exodus or influx of, especially in America, where a lot of African Americans are finding their roots. They're coming back home. I think Ghana will attest to this, where a lot of very popular people and celebrities are coming home. In the academia, I wouldn't want to mirror that. That influx, yes, it's time. And I think I'll just make this the last question before we round up today. It's been quite interesting. Is what are the incentives to get the great minds from outside Africa to come back home and invest, put money on the table, either as private or public participants? What do you think will make that happen?
Is that for me?
And this is open to anyone.
Again, we talk about history. I grew up with having a lot of Indians as my teachers. And people from Ghana, everybody came to Nigeria when the condition was good. Then everything became upside down. Industries left, people left. And the Indians are up to date because their government made their environment conducive to them. If we make our conditions conducive, the younger people will come and they will come back. So it's gone back to the place that we're saying it involves the public, it involves me, it involves everybody to get that condition we had before. Spend your money the right way. The money we're wasting in Africa, could have been done to improve our situation. Over.
Thank you very much.
On a final note, Professor, thank you very much.
Yes, just some.
Go ahead.
Yes, now we do have some technology is helping a bit, that you don't need to come back, but we can have the value of your mind. COVID in a way has accelerated that, so that we're talking with the minds across great divides without them necessarily coming back. So some of them are beginning to give lectures at home, are beginning to mentor from across the divide, because though they left because of the toxicity, their hearts are still here. So I think technology will ameliorate some of that, but we really still need to fix the systems, because the e-platform and the virtual world does not quite replace the presence on ground where they're part of this. Thank you.
Thank you very much for that. And on a final word, I think I'll just give the floor to Professor Odubanjo. And this question is very direct, maybe a scorecard. How prepared is Nigeria for the next pandemic, based on everything you've heard so far?
Well, first, thanks for the professorship. Simply put,
sorry,
that's conferred by you. So that's great.
In view.
Okay, great. It's a simple phrase. We're not prepared. We're not prepared. So that's the real takeaway. And if we do all the things that are being said and we address them, maybe we'll be prepared, but we're not prepared. No.
I agree with you.
Thank you very much.
Thank you, sir.
I didn't think you were going to disagree, Prof. But thank you very much. As bitter as this might sound, I think one of the first steps to solving a problem is identifying it and acknowledging that you do have a problem. And the problem is that we are not ready for the next pandemic. The problem is that the communication is not effective. The problem is that the funding, the proper funding and the proper management of the fund has not been achieved. And without effective communication, we can't get funding. And without that, we can't get data that drives the science, that drives the communication, that drives the solution. And in a nutshell, we do have a lot of work as a continent in terms of collaboration. Is there a possibility? Yes. Do we have the capable hands? Yes. Do we have the funding? I believe very much so, because we've seen our leaders, spend money in other areas that we believe might not be as a priority as health and the welfare of the nation. So I guess it's just about driving a narrative. I wish the Honorable Minister was here to listen and hear all of this, because it can start from his own end, a minister reaching out to South Africa, Kenya, Rwanda, whatever the case might be, and start that collaboration and pay action and not just lip service to this. On that note, ladies and gentlemen, thank you very, very much for your time, the panelists, those of you who contributed, those of you viewing, watching, wherever you are in the world, we thank you very much for taking the time to be here. The Conversation Africa will continue the conversation in Africa by Africans, for Africans, without sounding too cliche. But the idea is to move the continent to the next level, and I believe we have everything to do so. I'll hand over at this point to give the closing remarks, talking about the editor of the Conversation Africa. Please do make welcome Jabulan.
To the Honorable Minister, obviously in absentia, the esteemed members of the panel, and the wonderful ladies and gentlemen, thank you very much for the great honor that you have done the Conversation Africa by participating in this dialogue on science and policy, which we have co-hosted with our dear friends from the Nigerian Academy of Science. The Conversation platform was founded to make knowledge and expertise of the academic and research communities accessible to the public. We exist for no other purpose. So we are most grateful that you have made time today to share your expertise and insights on the intersection of science and policy. in particular at a time like this when the whole world is in the grip of the COVID-19 pandemic. So thank you very much, and I hope you enjoy the rest of your day.
So I just wanted to get the correct pronunciation of your surname. If you noticed, I've been rehearsing, but for some reason it just doesn't stick. So I'll need your help on this for future reference, sir. How would I pronounce that properly?
Sikakane.
There was no way I was going to get that. There was no way I was going to get that. Thank you very much, sir. And great work to you and the team for putting this together. The conversation is still ongoing and going on. Please ensure that you do have the takeaway from this particular conversation. And on that note, ladies and gentlemen, I want to take this time to say a big shout out to the team in Nigeria, especially that I've been working with in London and South Africa, that has made this Ogechi, Candice, of course, my Oga at the top, in terms of the editor himself, talking about the one and only Adejumo Ashoyinka Usifo, our technical guy. Thank you very much for this. It has been quite rewarding. To all our panelists, it was and it is profound, your dedication and your consistent dedication in your line of work. You've had every reason to just look the other way, but you've kept it going. And I think Africa thanks you for your passion of love. And we pray that all of this comes together to take the continent to the next level, and more importantly, to solve the problems that we have. I am Gbemileke Oscar Oyinson, better known as Oscar Oyinson, or Oscar in the City. And till the next conversation, have a wonderful day, a productive day. Stay safe, and God be with you. Bye-bye for now.